Hi guys, now we'll be starting with one more very relevant topic for you, that is nothing but injuries. Why this injuries topic is so important for you, right? This topic, knowledge on injuries, it is important for your medical practice. It is not only for medical practice, it is also important for your medico-legal practice. Medical practice, for treating the patient, you need to have a solid knowledge about the injuries, and not only that, for medical legal practice, for issuing wound certificates, if you happen to do autopsy, you need to issue postmortem certificate. In that, you need to document the injuries very correctly, precisely. Right? For all these things, a solid knowledge, a solid foundation on traumatology is highly essential for you, and that is what we are going to do in this particular unit, right? The traumatology, the injuries. To start with injuries chapter, we'll be starting with the first topic, that is mechanical injuries. We'll be starting with mechanical injuries. In mechanical injuries, to start with, let us start with the most basic stuff, that is classification, right? We'll start with the classification. We'll start with the basic point. Right. How can you classify mechanical injuries? The mechanical injuries can be classified based on the type of force that is involved. Right. Let us say if the person has got blunt force trauma. Right. If there is a blunt force, what are the injuries that is possible due to blunt force trauma? Do remember, we have got abrasion, we have got contusion, we have also got laceration. Abrasion is something where is a scratch which is involved only in the epidermal layer. Right? Contusion is something where the epidermis is not involved but dermis is involved. Laceration is something where both epidermis and dermis both will be involved. Right? And under the same blunt force trauma, we can also include fracture as well. Fine. So I've told you abrasion, contusion, laceration. We can also include fracture in the blunt force injuries. Now, other type of injury is a sharp force injury. Let's talk about sharp force. When you talk about sharp force, right, the sharp force can be a light cutting weapon like a blade, surgical blade. You can cause incised wound based on that, incision, incised wound, or the sharp weapon can be a heavy cutting weapon. Heavy cutting weapon may be a chopper, you can say axe, right? So it will cause chop wound, chop, right? Okay, but there are other instruments or any weapon which is having a pointed end. Any weapon with a pointed end or any instrument with a pointed end that can cause stabbing, right? We call it a stab wound. We call it a stab wound. Fine. And other things, you can say firearm injuries. Firearm injuries, explosion injuries. So all these are the other injuries that you can come across. So you need to have a basic concept. So this is very basic classification that we have seen now. Now we'll be starting with the first injury, that is abrasion. We'll be seeing individual injuries one by one. To start with, let us start with the first injury, that is abrasion. We'll start with the abrasion. Right. Okay, let's start with abrasion. The meaning of the word abrade means scrape. So this is basically scraping. This is basically scraping. What happens is, see, out of all the mechanical injuries, this is the most common injury that you can come across. Right? Each and every one of us must have sustained at least one abrasion in a lifetime. Right? If you say that you have not sustained even one abrasion in a lifetime, right, there are only two possibilities. One, you might be lying, or number two, like you may be very rare person. Right? Okay. So this is one of the very common injury, most common injury, that is abrasion. And you can say medico-legally, from medico-legal perspective, this abrasion is the most significant wound. You know why? Because it gives us lot of information, right? It gives us lot of information, medico-legal perspective, right? We'll be discussing one by one. For now, you know, this is one of the most important injury from medico-legal perspective. Fine. Now, when you say abrasion, let us say this is the skin layer. Let us say this is your epidermis and this is dermis. Fine. Now, there are two type of forces that can cause abrasion. One, there can be a force which can tangentially scrape it. Right? It can cause scraping. It can tangentially, it can scrape, or if there is any injury which is perpendicularly crushing the skin, that will also cause abrasion. Right? Either it is tangential or it can be crushing, perpendicular injury which can cause crushing. Right? There are two type of forces that can cause this kind of abrasion. Okay, one is tangential force, another one is perpendicular force. Right? Tangential force will cause scraping, whereas perpendicular force will cause crushing. Fine. Now, if you see this abrasion, see, this abrasion is something where only epidermis involved. Only epidermis is involved. Sometimes we can say only partial epidermis is involved, right? Sometimes it is not even complete epidermis involved. Most of the times it is only partial epidermis that is involved. Number one. Number two, since it is only the epidermis involved, there is no dermis involvement, you don't get any kind of bleeding. That is very, very important. Pure abrasion don't actually bleed. If there is any deeper abrasion, it may bleed. You can see some kind of bleeding spots, but usually abrasion, pure abrasion, they don't bleed, because it is confined only to the epidermal region, not below that. The most important point is it doesn't scar, it doesn't produce any scar. You know the reason? Because it is not involving the dermis. Since it is not involving the dermis, it doesn't produce any kind of scar formation, right? Any kind of scar formation. And that is the same reason why medico-legally, remember, medico-legally, most of the abrasions, you can say almost all abrasions are simple hurt, right? All abrasions are simple hurt, right? Except, why we say simple hurt? Because it doesn't cause any kind of scar, right? Except corneal abrasion, because corneal abrasion may cause scar, may cause opacity, right? And it may disturb the vision, right? It can cause visual impairment, and that is the reason why it may be a grievous hurt, right? Most all the abrasions are simple hurt except corneal abrasion that can be grievous because it can impair the vision because of the opacity that it can cause, right? So let's go forward, guys. Now, stay with me, right? Now we are going to learn the different types of abrasion, right? So be clear with that. I told you already, we have two types of forces. What are the two types of forces? Number one, tangential force that can cause scraping. Number two, perpendicular force that can cause crushing of the epithelium. Now we'll be discussing the first one, tangential force. The tangential force can cause two important types of abrasion. Number one, that is called scratch, right? Or you can also call it a scrape. Scratch abrasion or scrape abrasion. You can easily produce a scratch. One a single line will be there. That is basically a scratch, right? You can take a pen, you can make with the pointed end, you can just make a scratch. You can take a knife, with the pointed end of the knife, you can make a scratch. You can take a pin, you can take a thorn, you can take a nail. Everything can produce scratch, right? Everything can produce scratch. So that is basically scratch abrasion. Very, very simple. No doubt about that. Now moving on to the most important abrasion, that is called grazed abrasion. Grazed abrasion, right? So this grazed abrasion commonly produced whenever you have the friction between the skin and the rough surface, right? When there is a skin and you have a rough surface, when there is a friction between the skin and the rough surface, you get this kind of grazed abrasion. Friction between the skin and the rough surface, right? And usually it is broader. It's a broader contact between the skin and the rough surface. And when we say it's a broader contact, you can say the rough surface. One of the common example that you can think of is road. That is the reason why this grazed abrasion is very, very commonly seen with road traffic accident. And as I told you, almost every one of us would have sustained this kind of grazed abrasion. Fine. You can have a look at this. You can have multiple lines of scratches over a wide area. So this is how the grazed abrasion will appear, right? This is how the grazed abrasion will appear. And since it is caused by the road traffic accident, you have various synonyms for this. This is also called as gravel rush. Okay, gravel rush, fine. And you also call it as brush burn. Brush burn. It's a sliding abrasion, right? The skin is sliding on the rough surface, sliding abrasion, right? You call it as sliding abrasion, gravel rash. It's also called as road rash. Road rash. Right? See, out of all the abrasions that we're going to discuss, the most common abrasion is grazed abrasion, right? Because I told you the reason why this is very commonly seen with road traffic accident. Okay, done. Now moving further, the third type of abrasion. Before discussing the third type of abrasion, see, I told you scratch and graze, right? The scratch and graze are produced by tangential force. This is tangential force, right? Perpendicular force is something like this. Right? Now we are going to discuss the different types of abrasion produced by perpendicular force. Before that, I'll be showing you the abrasions you can see the abrasion. So this is abrasion. You can see epidermis is scraped, and this is your scratch abrasion. You can see a single line. Okay, even nail can produce scratch abrasions. Fine. So this is your grazed abrasion. You can see over a wide area, you can see lines of multiple scratches. Okay, so this is another grazed abrasion. You can see that. Okay, now we'll move on to the third type of abrasion. See, now I'll be telling you the concept behind that. Do understand the concept so that you will retain it for a longer time. You will understand it and you will retain it for a longer time. Let us say there is a skin. You can see that this is the skin. This is epidermis and this is dermis. Right? There is a force perpendicularly acting onto the skin. Right? Perpendicularly acting on the skin. Do make a note of it. Perpendicularly acting on the skin, producing crushing of epithelium. You can see crushing of epithelium. This is crushing. Right? When the crushing of epidermis do happen, you get an abrasion that is called pressure abrasion. But here, the pressure abrasions, what kind of force is? The force is less, right? But it is applied for a longer time. Force is less, but it is applied for a longer time. So this kind of pressure, sustained pressure on the skin, producing an abrasion. This abrasion is called as pressure abrasion. This is called as pressure abrasion. Right? Okay. Right. Now there is one more type of abrasion wherein you can see this is the skin. Again, epidermis and dermis. You give the force perpendicularly to the skin. Right? But here you can see there is larger amount of force. Right? The force is more, larger amount of force. Let us say a tire, run over injury, a tire running on the body part. Right? You can see a gun kept on the skin. Right? More force but less time. Right? It's just a momentary impact. It's a momentary impact causing a crushing of the epidermis. Right? The final result is same. You get only crushing of epidermis. The difference matters only when you have a larger force, lesser time, right? Lesser force, larger time. So that is the difference. When you have this kind of abrasion, this abrasion is called as impact abrasion, also called as imprint abrasion. It is called impact abrasion, also called as imprint abrasion. Okay, so it is seen when the force is larger, but the time is very, very less. Right? If you want me to give the example, I'll give you the example for this pressure abrasion. Do remember, the example for this kind of pressure abrasion is the ligature mark. Right? The ligature mark sustained for a longer time on the skin, causing this type of pressure abrasion. And another example, the easiest example that we come across very commonly is shoe bite. Right? New shoes biting us, shoe bite. Okay? Right. And this one, the impact abrasion, larger force, little time, you can think of tire mark. Right? You can think of tire mark. You can also think of recoil abrasion. I told you when you keep a gun on the skin, and then in a contact shot you pull the trigger, right? In a contact shot it can produce an abrasion around that wound, right? We'll be discussing on that in ballistics. For now you remember this is recoil abrasion, right? If you want me to give another example, I can give you radiator grill mark, right? In road traffic accident, radiator grill mark, the pattern, you can see that. Okay, fine. So this is another example of imprint abrasion. Now, moving further, you can see, right, there can be a pressure abrasion, there can also be an imprint abrasion. But here, sometimes what happens, whether it is pressure abrasion or imprint abrasion, what happens is, right, the force, because of the force, there can be a crushing of epidermis, right? You can see crushing of epidermis, right? But you will also find out the pattern of the weapon, right? You can also find out the pattern of the weapon on that area, right? So if you have a force, let us say this is the weapon which is hitting on the skin, right? Because of the pressure you get crushing. In addition to that, you are able to observe the pattern of the weapon, pattern of the striking surface, right? In that case, this can be called as patterned abrasion. right? So it is called as patterned abrasion, right? Whether it is pressure abrasions or imprint abrasion, if it is showing you the pattern, you can call it as patterned abrasion. For example, I told you in case of pressure abrasion, you can say that is ligature. Let us say this is the neck of the person, and you can see here, right? You can see a ligature mark. Fine. Let us say if it is a patterned abrasion, you can see this is again a ligature mark, but in the ligature mark, you are able to see the pattern of the material that was used. Okay, fine. So it's very simple. If you're able to see the pattern, you call it as patterned abrasion. As simple as that. And which is the most common abrasion? The most common abrasion is a grazed abrasion. Fine. Now going forward, let us talk about what are the medico-legal relevant points that we can make out from this, right? The first important thing is aging, right? Aging of abrasion. Do remember, we all know how it heals. It generally what happens whenever the skin is abraded, whenever the skin is scratched, right? You get a scab. What is a scab? Scab is a dried lymph, right? Scab is a dried lymph, and the color of the scab will keep on changing. As the abrasion keeps on healing, the color of the scab will keep on changing. Based on the color of scab, we'll be able to find out the aging of abrasion. What is this aging of abrasion? It is basically identifying the time since injury, TSI. Alright, you might have heard about TSD. TSD means time since death. TSI means time since injury. So how many days back the person sustained this injury? So that's what we're going to find out. Why is this important? This is so important, right? This is so very important for whether you are examining the patient, you are able to see the injury, you are able to assess the time since injury, and you need to correlate with the history or not, whether the person is giving you correct history, whether the history correlate with the finding or not, that you can make out with this aging of abrasion. Not only that, whenever we document the certificate, and it is important for us to know about this aging of abrasion concept, and we need to find out the time as well. So let's go forward. Right, for you to learn this aging of abrasion, I'll tell you easy way to remember. You can remember R cube B cube, right? What is that R cube B cube? Triple R and triple B, right? You can remember R R R and B B B, right? How can you write this? First R B B and B. This is how you need to write. Once you write this, then everything will become very easier for us to remember. Do remember, the first one is raw, fresh abrasion without any scab, right? Then we have got reddish scab. Reddish scab. Scab is so reddish. Then we have got reddish brown scab. It is turning into brown, reddish brown color scab. Then what is that B? B is brown color scab. Right, B is brown color scab, and the last one is black. Finally, the black scab will fall off, and you can see the skin. Right, what happens is now the epithelium will grow under the scab and it will epithelize. Right, within a week, what happens is within a week the scab will fall off and the abrasion will heal. So you can say it will take 1 week for the abrasion to heal. Fine. Raw, reddish, reddish brown, brown black. Fine. Once you know this, you can easily find out the age of this. You can remember less than 12 hours, more than 12 hours. Okay. Then you have got 2 to 3 days, 4 to 5 days, and 6 to 7 days. Patient is coming to you. Patient is telling that he has got some injury, and you are examining the injury. It is looking reddish brown in color. What is the time? He must have sustained that injury 2 to 3 days back. Okay, patient has come to you, patient is telling you that he has got injury, you are examining the injury is showing brown color scab, that means he got sustained that injury 4 to 5 days back. Okay, so it will tell you an idea how many days back he sustained that injury. So this is highly important. This is highly important. Do remember, this is aging of abrasion, right? And as I told you that it will heal within a week. Fine. Now going forward, the next important medico-legal aspect that you need to think of is direction of force. Is it possible to find out the direction of force from an abrasion? Is it possible, first of all? So we'll discuss about that. See, I told you, you need to remember the concept, guys. I told you the concept that abrasion is produced basically by scratching, tangential force. So what happens is, let us say this is the pin. Let us assume it is not pen, it is pin, right? When you scrape here, right, whatever epithelium that you scrape here in the beginning, it will be carried away. You can see everything is heaped up in the tail end. right? So that is basically what you expect in an abrasion. You can see this is your skin. This is your skin. Suppose if the force is transmitted on this side, what happens is you can see all this abrasion here, right? You can see all this abrasion here. But whatever epithelium that is being scraped from the beginning, it will get, right? You can see it's heaped up here. We call this as epithelial tag. Do remember, this is called epithelial tag. It is also called as heaping up of epithelium, right? It is also called as heaping up of epithelium, right? Where will you find the epithelium heaped up? Is it in the head end or tail end? Is it in the beginning or end? Yes, you will find that in the tail end of an abrasion, by which you can easily find out the direction of force. So this is second important point that you can make out from abrasion. The third important point that you can make out from this is you can also comment on the manner of injury. Suppose if the person is dead, you can also say it is manner of death. Right? What do you mean by manner? Right? Manner means either it is accidental, or is it homicidal, or is it suicidal. Fine. In general, what happens is you can comment on whether it is homicide or it's accident, sometimes suicidal. Right? If you want me to give an example of homicidal manner, I can give you example of smothering. Right? You know what is smothering, right? Smothering is basically closure of external airway like this, and you close the mouth and nostrils, person is not able to breathe, person dies. But when you close the mouth and nostrils like this, you see if you have nails, you produce nail abrasions around the mouth, right? So it will tell you it is smothering, and you know that is homicide. And another example you can say that is throttling. What is throttling? That is manual strangulation. When you compress the neck of the person with your hand, you can have this nail producing nail scratches on the neck. So by looking at the placement of the abrasions, you can make out what condition it is, and you can also comment on whether it is accident, homicide or suicide. And suppose, see, in accident case, you can easily find out whether it is multiple grazed abrasion all over the body. You can say could be a road traffic accident, right? So you can also comment on the manner as well. See, so far I've told you about direction, I've told you about the aging, I've told you about the manner. Sometimes if there can be foreign particles, right, the person fell on the ground, right, fell on the road, right, that kind of foreign particle may be present, mud particles may be present in the abrasion, by which you can comment on the scene of crime as well. So these are the information that is given by abrasion, and that is the same reason why I told you that abrasion is the medico-legally most significant injury. Right? I told you abrasion is the most significant injury. That is because it gives you so many medico-legally relevant information. Okay, going forward, before that I'll show you that pressure abrasion. This is your ligature mark. Right? I shown you this scratch, I've shown you about grace. So this is your pressure abrasion. You can see this is another abrasions. You can see this is the ligature mark, right? You can see the ligature mark. Everything is pressure abrasion, right? This is bite mark, right? Bite mark is also an example of pressure abrasion. You can see bite mark. You can see crescentic mark. Okay, right. Now see this abrasion. Usually it is antemortem, right? Sometimes it can be postmortem as well. The reason is, see, usually the abrasions are antemortem, sometimes it can also be postmortem. The reason is sometimes what happens while they're transporting the body, there can be rough handling of the body. You may get postmortem abrasions as well. Other than that, you may get hand bite marks, all these things which are differential diagnosis of abrasion. That is not so important. But do remember, I'll tell you how to differentiate an antemortem abrasion and postmortem abrasion. That is important for you, right? Even for practical purposes also, this is very important. See, when you see a person, when you see a dead body with an abrasion, you should know whether it was sustained, whether he was alive, or that injury happened after his death. You need to know whether it's antemortem abrasion or postmortem abrasion. It is so simple. I'll tell you how to find it out. There is no complexity here. It's very, very simple. Number one, antemortem abrasion. Where do you see this antemortem abrasion? The antemortem abrasion is normally seen anywhere, depending on the site and depending on the trauma, right? It can be seen anywhere. But usually the postmortem abrasions are seen with bony prominences. It is seen with bony prominences, right? Like occipital region, the elbow, in all these bony prominences, right? It can happen. Fine. What about the color? Normally antemortem abrasion is usually, you can say it is reddish or reddish brown depending on the healing pattern. You can say it is erythemic or reddish. But this postmortem abrasion, there is no healing pattern. It is completely pale, or you can say yellow. You can say yellow. What about vital reaction? Right? What about vital reaction? Do remember, vital reaction, the inflammatory reaction is seen only with antemortem abrasion. It is not seen with postmortem abrasion. You know that, right? You know that. It's very, very, very simple concept, right? Only when the person is alive, the abrasion will heal. Only when the abrasion is healing, right, the inflammatory, all the changes can be noted. Okay, so you can see vital reaction will be noted in antemortem abrasion, and the postmortem abrasion does not show any kind of inflammatory reaction, the vital reaction. In the same situation, I would like to give you another concept that you need to understand. Let us say any injury. So it's not only applicable for abrasion. Let's say any injury is there. Let us say this is one injury, right? This is an injury, right? Fine. Now what happened? The person is alive. When the person is alive, you can see there is wound area. This is wound area. Just close to the wound area, there can be necrotic area. Necrotic tissues will be there. That is where you will have negative zone. We call it as negative zone. There is decreased enzymatic activity. Decreased enzymatic activity. That is because the tissues are necro, so there is no healing pattern, so there is no kind of increase in the enzymes. Fine. But just next to that, just very close to that zone, you will have another zone. That zone is a positive zone. We call it as positive zone, and this is the positive zone wherein you will find increased enzymatic reaction. Why this increased enzymatic reaction? The body is attempting to heal that area. The body is attempting to repair that area. When the body is attempting to repair that area, obviously you will have increase in enzymes, right? We call it as positive zone, right? There are some measurements, right? 0.1 millimeter, 0.3 millimeter, all these things are not so important. Just know the concept. There is a positive zone and it will show increased enzymatic reaction, right? Increased enzymatic activity will be there. But you tell me guys, when a person is this kind of increased enzymatic activity will be seen in a person who's alive, or is it seen with the person who's dead? Yes, this will be seen only when the person is alive. So this will be seen only when you have antemortem wound, right? This kind of enzymatic reaction will not be seen with the postmortem wound, right? So this is what you need to remember, right? This can, as I told you, this can be applicable in all the injuries, right? Fine. So remember positive zone and the negative zone. The closest you have next to this wound, you will have the closest one that is negative. Then adjacent to that, you will have positive. So the next injury that we are going to discuss is called contusion, right? Which is also called as bruise, right? Which is also called as bruise. See, to put it in simple word, right? To put it in simple word, it is basically the collection of the blood. It is basically the collection of the blood in the tissues. It can be in the skin, it can be under the skin, it can be in the organ, right? It is basically the collection of the blood, right? We call it as contusion, also called as bruise. You can remember C for collection, B for bruise. Okay, B for, right, blood. Okay, you can remember like that. Now, see, technically, right, practically, both the terms are synonymously used. But there is a small difference technical difference between the term contusion and bruise, right? Bruise is a term we normally use when there is an injury on the dermal area, that is on the skin, right? But contusion is something where in the internal organs, liver contusion, splenic contusion, renal contusion, lung contusion, cardiac contusion, heart contusion, brain contusion, right? So technically it is like that, but practically both the terms are synonymously used, interchangeably used. Fine. Let's discuss the mechanism of contusion. So that is again very, very important. Let us say this is a skin, right? you have this epidermis and you also have dermis. You know very well, the vessels are located in the dermal region, right? Not in the epidermis region. If there is a force acting on the skin, there is a blunt force acting on the skin which is not disturbing the epidermis. Epidermis will be intact. Epidermis will be intact. Because of the force, what happens? The rupture of the vessels do happen, right? These vessels, they rupture, right? Because of the force, the vessels in the dermis, they get ruptured. Because of that rupture, you get bleeding. Right? Epidermis is intact, so blood cannot come outside. So that blood will get collected there itself. Right? See, when there is a bleeding happening here, we use a word we need to know, that is called extravasation. Right? Blood is diffusing into the surrounding tissue, that is called extravasation. That is one very important terminology that you need to remember. Make a note of this, guys. So this is highly important. Extravasation. Now, it's very simple. You have a trauma, vessels getting ruptured and the blood getting collected. Because of this blood collection, what happens? Sometimes there can also be a swelling in that area. Right? There can also be a swelling in that area. Associated with, you will have some reddish discoloration. Right? You will have swelling, and you will also have discoloration. Right? That is what you see from outside on the skin as contusion. When you see on the skin, you will see a discoloration and swelling. That is basically this. When you look at the margin, see, remember, this blood is diffusing into the tissues. That is the reason why when you look at the margins, right, when you look at the margins will be ill-defined. Right? This is again one of the very important point. Make a note of this, guys. We'll be discussing it again later. I'll tell you where it is highly important, where it is so relevant. So do remember, it is ill-defined, or you can say irregular, whichever way that you want to have it. Fine. So I've told you all the keywords that you need to remember with regard to this. You can also note that, can you tell me which layer of the skin is affected? Is it epidermis or dermis? Yes, epidermis is not injured, only the dermis is getting affected. Dermis is injured, dermis is involved. In contusion, you have the involvement of only dermis. Right? Only dermis. There can be associated abraded contusion, right? That's a different thing. Pure contusion, you see only the dermis getting involved. Fine? So let's go further. Let's talk about the different. I hope that you have clarity on it, right? So this is the slide that I'm giving you. You need to have a proper concept about the mechanism, right? Once you understand this, see, I've given you all the keywords that you need to know, right? These keywords will help you to understand the concept. It will also help you to answer the questions. What are the vessels that we're talking about? Vessel that can be vein, it can be venule, it can be arteries as well. It can be vein, it can be venule, it can be arteries as well. Can be anything. Fine. Let's go forward. Let's talk about the types of contusion. Right? Number one, it is called intradermal bruise. Number one, it is called as intradermal bruise. Right? It's very close to the skin. We call it as intradermal. Right? The next one is your subcutaneous bruise. It is under the skin, so you can say it is subcutaneous bruise. The name itself explains that. There is no further explanation needed for this. Right? And the third one is, you have what is called as ectopic bruise. This needs some explanation. I'll tell you what it is. I'll explain this what it is. Ectopic bruise. See, you might have heard about ectopic pregnancy occurring away from the uterus. Likewise, here's the bruise occurring away from where? Away from the site of impact. If you hit at one region, you will expect the bruises at the same region, right? But this is where in ectopic bruise, when you have an impact in one region, you don't get bruise at that region. You will get bruise at some other region. Right? We'll discuss that concept. You can see this one. If this is the skin, let us assume that this is the skin and you hit this area, right? That is the site of impact, right? This is the impact site. You would normally expect the bruise to develop on that side. But what happens under under that area, you might be having rupture of that vessel, but this blood will not come at that side. It will gravitate down, right? And it will be appearing away from the bruise, will appear away from the site of impact. This is the site of bruise, right? So what did I tell you? It is a bruise present away from the site of impact. Bruise which is presenting away from the site of impact, we call this as ectopic bruise. We call this as ectopic bruise. Fine. And this ectopic bruise, it is basically due to the gravitational shifting of the blood. It is basically due to the gravitational shifting of the blood. You can remember gravity, right? Gravitational shifting. Fine. So this bruise, ectopic bruise, is also called as migratory bruise. This is also called as migratory bruise because you can see that the blood is migrating. Not only that, this is also called as percolated bruise, which is also called as percolated bruise. Everything is same. You just need to know the synonyms, because sometimes in the examination, instead of giving you the straight term ectopic bruise, they will try to give you synonym and try to confuse you. You just need to know the synonyms, right? So this is ectopic bruise. What are the examples that you would like to know? Number one example, that is called black eye, right? Black eye, right? You hit in the forehead, you will have blood collection in the, if there is an injury in the forehead, you will have blood collection in the periorbital region. That is because of gravitational shifting. We call it as black eye. Bilaterally, you call it as raccoon's eye, right? Raccoon's eye, right? Spectacle hematoma. You have so many synonyms for this, right? But you know the concept, right? You know the concept. Then you have what is called as battle sign, right? What is that battle sign? Battle sign is something where, right, patient has met with an RTA, let us say RTA, and he has got head injury, admitted in the hospital, right? You are examining the patient in the ward, you are examining the ear. Behind the ear, you are able to see an ecchymosis in the mastoid region, right? Usually you can see in 12 to 24 hours, you can see the ecchymosis in the mastoid region. This is one very important sign that is called as battle sign. What does it tell you? It tells you that there may be a fracture in the middle cranial fossa, right? This is again very important. This is a fracture in the middle cranial fossa. Fine. So this is called battle sign, which is another example of your ectopic bruise, right? And sometimes you can also say, like, if the patient has come with acute abdomen, this is your umbilicus, you can have the, right, Cullen's sign, periumbilical, or sometimes you can also see in the flanks, we call it as Gray Turner sign. Can be Cullen's sign, Gray Turner sign, that can also be considered as ectopic one, right? Cullen's sign and Gray Turner. Fine, Gray Turner sign. Okay, fine. You have a lot of examples for that. Suppose you kick the person in the calf muscle, back of leg, calf muscle. Will you get hematoma in the calf muscle? No. The blood will gravitate down. You will get a blood collection behind the tendocalcaneus. You will get that behind the ankle, right? You hit the person in the lateral aspect of the thigh. The contusion may not be present in the lateral aspect of the thigh itself. The blood will gravitate down. You will see the collection of the blood in the lateral aspect of the knee, right? So these are all the different examples that you can think of for ectopic bruise, right? And then we have one more important type, right? That's about ectopic bruise. And we have one more important type that is called deep bruise. It is present deeper to the tissues. It is present deeper tissue. Name itself tells you. But sometimes what happens, the deeper tissue, it may not be visible in the first examination itself, right? Immediately after the impact, you may not be able to see any kind of bruise, but this bruise may be presenting after few hours or few days. We call it as delayed bruise. It is presenting later. It is presenting later. We call it as delayed bruise. It is because the blood is coming out, right? Blood is coming out through the layers. This is also called as come out bruise. And that is the reason why normally what happens, like in case of, let us say, example of sexual assault survivor, right? Sexual assault survivor, when you examine in the first examination, there may not be any injury noted, right? You may ask the patient to come after 2 days or 3 days. In the repeat examination, you will be able to find out few important bruise, right, in the inner aspect of the thigh and the other regions. That doesn't mean that the person has got sustained that injury in that gap of 1 to 2 days. It's not so. In the first examination, that particular injury bruise was not visible, it was deeper. In the 2 days, it has come out presenting as delayed bruise. So do remember, this delayed bruise has got lot of medico-legal significance. Right? Let us say if the same sexual assault survivor was examined by first doctor on the first day, right? He has issued a certificate where he did not note any kind of injury. There was no injury mentioned in the certificate. For some other reason, the same survivor was examined by another doctor after 3-4 days, and that person was noting all the injuries noted. That doesn't mean that the first doctor has made a mistake. It's not like that. So for that, you need to know the concept of this delayed bruise. Some bruises may not be visible immediately after the impact. It may be presenting after a gap, right? We call it as delayed bruise. Do remember that concept, that is called delayed bruise. Now, the next type of bruise is called as pattern bruise, right? Pattern bruise. The name itself explains what it is. It will give you an idea about the pattern. It will give you an idea about the pattern. Okay? Pattern of what? Pattern of what? It is not the pattern of weapon that you're talking about. That is wrong. It is the pattern of the striking surface of the weapon. That is correct. That is highly precise. Right? Striking surface of the weapon. Right? When you say pattern of the weapon, it doesn't show you the exact pattern. If the person was hit by some other lathi or something, the exact pattern is not visible over there. Whichever part is striking on the skin, that particular part, the striking surface of the weapon alone is being imprinted. You call it as pattern bruise. We call it as pattern bruise. Fine. Let's see a few examples of that. Okay, the first one, what we can think of is tram line bruise. Tram line bruise, also called as railway line bruise. Railway line bruise. Right? So tram line bruise or railway line bruise, you can see the tram line bruise or railway line bruise will be exactly looking like this. Right? It will be looking like a railway track, and that is the reason why it's called railway line bruise. When you see this kind of bruise, on the skin, right, don't think that the person was hit by two different weapons. First of all, what kind of weapon that it can cause this type of tram line bruise? It can be any weapon with a longitudinal, which is so longitudinal, right, cylindrical, just like your lathi, stick, cane, iron rod, pipe. All these things can cause this tram line bruise. And as I told you, like when you see this type of two line, that doesn't mean that the person was hit by two different weapons. It's not so, right? I'll show you the mechanism of that. You need to have a look at it. See, when you have, let us assume that this is your stick, right? You hit on that skin. What happens is the part of the skin where the stick was compressing, right? That area will be completely pale. Adjacent to that, on either sides of that stick, the vessels will get ruptured. You will get bleeding on that area. You will get two lines, right? I'll show you the figure, right, for that. So now you remember, this is called tram line bruise, also called as railway line bruise. Okay, going forward, right, another important type of pattern bruise is your donut bruise. You people might have eaten donut, right? We all eat donut. Right? Donut bruise. What is that? It will exactly look like a donut. You can see it is looking like a donut. When do you get this type of bruise? Donut bruise? Donut bruise is produced when a person is hit by any spherical object. Like a ball. Right? It can cause donut bruise. Fine. Now, we'll see the next bruise. That is your butterfly bruise. Right? The bruise looks like a wing of a butterfly, right? Normally you get that in skin pinching, right? You get something like this. You get it in skin pinching, right? Particularly in a child, if you see something like this, you can think of child abuse, right? Child abuse, pinching the skin. Fine. Right. One more important type of bruise that we have to know, right? That is six penny bruise. What is that six penny bruise? Six penny is an English coin. Six penny coin. The bruise will be exactly looking like a six penny coin. The bruise will be exactly looking like a six penny coin. Six penny coin. And that is the reason why it is called as six penny bruise. When do you get that? You get this whenever there is pressure of pulp of the fingertip pressure, right? Fingertip pressure on the skin, you get this six penny bruise, right? You get the six penny bruise when you have pressure of the tip of the finger with the skin. You get a dead body for autopsy. In the neck of the victim, you are able to see bruises like this, round coin shape bruises like this. That is six penny bruise. What can you think of? What could be the case? This case could be a case of manual strangulation, also called as throttling. And do remember, this six penny bruise can also be seen with child abuse. It's also seen with child abuse, right? So basically, you need to remember it is six penny bruise, a round bruise. It's a coin shape bruise. Fine. So we have seen all the different type of bruise in patterned, right? There is one more type of bruise I would like to tell, that is called artificial bruise, pseudo bruise. Artificial bruise, pseudo bruise. When we say it is pseudo bruise, it is not produced by a trauma. An original bruise is basically produced by trauma. Pseudo bruise is not produced by trauma. It is malingering, right? It is basically people fake, right? People fake bruise by applying, right? By applying some inflammatory juice, right? Usually it may be from a plant like Semicarpus anacardium, Calotropis. When they are applying some plant juice which can cause inflammation, right? It will resemble blister and people will use it as artificial bruise, right? By applying plant juice, right? These plant juice will produce inflammation. It produces inflammation, and when you have inflammation, you will have vesicles, that is blisters, and people will use this for malingering. People will use this as a bruise for malingering purpose, for faking purpose. And as I told you now, I've given you the keyword how to differentiate. In a true bruise, you never find blisters, right? True bruise, we never find blisters, but in a pseudo bruise, we find blisters. In pseudo bruise, we find blisters. Okay, fine. So let us discuss about that. Okay, so we have discussed about that, the artificial bruise. So I've told you the different types of bruise. I would like to show you the bruise basically, right? Now you can see this is how the bruise will appear. You can see the discoloration on the skin. Fine. You can see this is the contusion. You can see swelling and discoloration. Fine. In case, suppose if you make an incision in that area, what will you find inside? What will be the content? Yes, you will find blood inside. Is it not? You will find extravasated blood. So the point is, when you see extravasated blood like this, suppose you incise that area, right? You incise that area, pour water on that area, try to wash it away. Will it get washed away or still it will remain, right? What do you think of? What do you think of? If you pour water, try to wash it away, will it remain or will it get washed away? Do remember, this is a contusion, it's a clotted blood. Even if you pour water after incision, do remember this contusion will persist. It will remain. It will not get washed away. This is one more very, very important point that you need to remember. The what we have done now is called as incision test, right? You put incision, pour water, try to wash it away. This is called incision test. Will it get washed away or not? It will not get washed away. It will remain. Okay. So this is another important point, right, for you to assimilate. Fine. You can see this is contusion. As I told you, make an incision, you will find the blood inside, right? You can see this is a contused area. When you make an incision, you can see the blood inside. Fine. This is an ectopic bruise. You can see injury in the forehead, but you can see the collection of blood in the periorbital region. Right? You know very well, this is called battle sign. You know very well, this is one of the very important high yield MCQ that you can expect in the examination. Okay, I told you tramline bruise, this is the mechanism of the tramline bruise. I told you when you have the stick on the surface of the skin, the place where it was compressing, this is the place of compression where there is no rupture, there is no bleeding. That is the reason why you see there is a pale region. Right? On adjacent sides, this is the place where the blood vessel get ruptured, you will get bleeding, and that is the reason why you will get two lines like this. This is the place where it was compressed, and both the sides you can see the stretching of the vessel getting ruptured. Fine. Sometimes what happens, the distance between the two lines will give you an idea about the width of the weapon. Okay, it can give you some idea about the width of the weapon. So that is again very important. Right, so we have seen all the different, I've given you all the different types of bruises. I've given you the pictures of it, images of it. Right, now let's go further. What are the factors that involves the appearance of the bruise? What are the factors that influence the appearance of the bruise? What are the factors that influence? We'll discuss one by one. Number one is the type of tissue that we are talking about. It is a tissue type. It is a tissue type. Okay. If the type of tissue, if the tissue is so lax, or if it has got loose areolar tissue, if it has got loose areolar tissue, even with a smaller force, the bruising will be more. Bruising will be more even with a smaller force. What is the example that you can think of? You can think of periorbital region, that is eyelid. You can think of scrotum, right? These are all the place, right, where you can have lesser force, more bruise. Sometimes even if the vascularity is more, the bruising will be more. Example is face, right? The more vascular it is, the more bruising it can cause. Okay, and the next is bony prominences. If the skin is very close, to the bone, even with a smaller force, you will get lot of bruising. Right? You will get lot of bruising. Bruising will be more. Right? You can have a pretibial region, scalp. You can see normally what happened, the scalp contusion, right? I would like to tell you another point. Scalp contusion is better felt than seen. Right? Can feel. You need to run your fingers through the hair. You'll be able to feel the scalp contusion better. Better felt than seen. Okay, fine. Then what about, I told you, loose areolar tissue, the bony prominences. What if it is opposite? If it is loose areolar tissue, the bruising will be more. What if it is exactly opposite? If the tissue is so firm, right? If the skin is so firm, thick fibrous tissue, the bruising will be very, very less, right? With a given force, the bruising will be very less. What is the example? I've already given you the hint. Palm, right? Palm and the soles. Bruising will be less, right? Okay, right. Depending on the gender of the person. Females will bruise more than males because of the delicate subcutaneous tissue under the skin. Okay, and of course the age of the person, right? The children and the elderly people will bruise more. Again, it is based on the type of tissue. The bruising will be more. Right? Children will have a very delicate subcutaneous tissue, whereas the elderly people, again, you have some kind of arteriosclerotic changes will be there, right? And that is the reason. And supportive tissue will also be less. And that is the reason why bruising will be more. Just remember, child and elderly person will bruise more. Okay, any other condition, suppose if the person is having any other natural disease, like for example, if the person is having any bleeding disorders, again, even with a smaller force, the bleeding will be more, right? And what matters is, again, the most important part is skin complexion. That is again important. I don't mean to say that skin complexion will affect the the quantity of bruising. It's not about that. Suppose if the person is a fair complexion people, the bruising will be better seen. Okay, fair skin people, bruising will be better appreciated. Bruising is better appreciated. Fine. So these are all the different factors that you need to keep in mind when you're looking for bruise, when you're examining bruise, and when you're reporting bruise. Right? Fine. Next important aspect that we have to think of is aging of contusion. We discussed about aging of abrasion. We should also think about aging. We should also discuss about aging of contusion, aging of bruise. It's very, very similar to the abrasion. Whatever medical legal important points I told you, why we need to know aging of abrasion, the same thing applies to aging of contusion as well. But aging of abrasion was done by the color of scab. Here there is no scab. Here you need to look at the color of the contusion itself, color of the bruise itself. Right? Color of the bruise itself. Practically color of the bruise. But what are the different ways by which we can do it? Number one, we can do it from the color of the bruise. Number one, we can assess the age from the color of the bruise. Number two, we can do spectrometry. Spectrometry. Number three, suppose if you're doing autopsy, you can do histology, histological studies, right? Or while doing the same thing, you can also do the reaction that is called Pearl stain. Reaction can be done, Pearl stain test can be done, right, for demonstrating hemocystine. So all these things are available, right? What is more commonly done is, the more commonly done one is color of bruise, and that's what we're going to discuss, and this is what commonly asked in the examination purpose. For you to learn the color of the bruise, so the different colors that you get, do remember, see, first of all, what I'll tell you is you need to know the basic concept. What is the basic concept? I told you earlier, dark complexion people, appreciation of bruise will be little difficult, and fair complexion people, appreciation of contusion will be better, right? Number two, the more vascularity that it shows, when the area is more vascular, when the area is more vascular, when there is more vascularity, the healing will also be faster, right? Healing will be faster. Fine. So this is one important concept that you need to keep in mind. If a particular area is having good vascularity, healing will be faster. If that particular area is having less vascular, poor vascular supply, then obviously the healing pattern will be less. Right? Let's talk about the different pigments and different colors. For you to learn these colors, I'm not giving you any kind of factual data. I'll give you the concept behind it. Right? All the color depends on the pigment that is responsible. Right? So when you have a collection of blood, gradually what happens, the pigments will get broken up and you get a series of pigments that is happening, and based on the pigment only the color is changing. Okay, I'll give you the concept. First, what happens if there is a fresh contusion, you will have oxyhemoglobin, right? And after some time what happens, the oxyhemoglobin becomes deoxyhemoglobin. Fine. And the deoxyhemoglobin after some time is broken down into hemosiderin, right? Then you have biliverdin. Some books mention as hematoidin, right? Biliverdin. Finally, you get bilirubin, right? So these are the serial disintegration products of the heme, right? Oxy, deoxy, hemosiderin, biliverdin, bilirubin. If you know this, you can easily find out the colors. What is the color of oxy? Oxy is red color. Deoxy is blue. Hemosiderin, that is dark brown or violet, right? Dark brown or violet. Biliverdin is green, and finally you get bilirubin, that is yellow, right? So you know that, right? So these are the colors. These are the colors. They can give you something like this. Patient has come with multiple contusions. Contusions are looking bluish in color. What is the pigment responsible for that? The pigment responsible for that is deoxyhemoglobin. You don't have to memorize it. Just understand the concept. You will be able to answer it very, very easily. Fine. You can see the colors. This is how it will appear. You can see first it is red in color, then it is blue color, then it is violet brown, then you have green color, finally yellow. Remember, the contusion heals completely in 2 weeks. Right? In 2 weeks. It comes to the original color, normal color. Whereas abrasion, you remember guys, abrasion I told you 1 week. Whereas contusion, the bruise, it takes 2 weeks. It takes 2 weeks. And that depends on multiple factors, right? Okay, let me tell you what are the other points that you need to know with regard to this contusion. Fine. I told you number one, depend on the vascularity. Number two, it heals within 2 2 weeks, right? And the color change, do remember the color change, it occurs from the periphery into the center. From the periphery into the center. Right? It is not from the center to periphery. It is from the periphery into the center. Right? Okay. The next point that you have to know is, right, there are some places where there is no color change. There are some places where if you have bruise, there is no color change at all. What are the sites? Number 1, subconjunctival hemorrhage. Subconjunctival hemorrhage, where the oxygen diffuses directly from the atmosphere. Subconjunctival hemorrhage, there is no color change. You don't get red, blue, brown, green, yellow. All these things you don't get. You get red color hemorrhage and gradually that is resolving into yellow color. Right? Not only that, meningeal hemorrhage. Even meningeal hemorrhage does not show any kind of color change because there can be oxygen diffusion from the CSF. Okay. Not only that, even subgaleal hematoma. Right? In all these places, you don't find any kind of color change. Right? Fine. Suppose a patient has come, patient has got multiple bruises. One bruise is red in color, another bruise is blue in color, another bruise is yellow. What does it mean? He has got multiple bruises. The patient has got multiple bruises and each bruise will have different color. What does it mean? What does it mean? When you have multiple bruises, of different colors, that means the patient is subjected to chronic trauma, repeated trauma. And the patient happens to be a child, do remember that is a sign of child abuse. Alright, one of your previous NEET MCQ. That's a sign of child abuse. You can easily suspect it could be a case of child abuse. It could be a case of child abuse that you need to remember. Okay, fine. So these are the points that you need to keep in mind when you are examining the bruise. You can have this. Yes. Now, there is one more important discussion that we need to have with regard to contusion. See, whenever we examine contusion, what happens is, it sometimes when you have a patchy livor mortis, we discuss hypostasis. If there is a patchy hypostasis in the beginning stage, sometimes we get confused between contusion and hypostasis. It might look alike, right? It may look alike, it may look similar. Then how to differentiate, right? For that, we don't have to learn anything new. What we have already learned everything, right? We have already learned all the points, relevant points. We just have to fill up all the points in this table. That is enough. Fine. So you can yourself answer this. What is the site of livor mortis? The livor mortis is commonly seen in the dependent parts of the body. What about contusion? Contusion, you cannot ask him to only eat in the dependent part. He can eat anywhere, right? So it can be seen. Trauma can be seen anywhere. Fine. What about the margins? I told you, you need to keep in mind, if it is a contusion, you will have ill-defined margin, irregular margin. Whereas if it is livor mortis, you will have well-defined margin. Right? Regular margin or well-defined margin. Okay. Where do you see blanching? Application of pressure become pale. It is seen with livor mortis, not with contusion. Where do you see extravasation? Extravasation, I told you very clearly, that is seen with contusion, not with hypostasis, right? Color change, red, blue, brown, green, yellow. As it heals, that is seen only with contusion, not with hypostasis. Incision test, when you pour water, try to wash it away, which will not get washed away. Yes, contusion will remain. In case of hypostasis, it will get washed away. So that is again very, very important. Okay, so these are all the points that we have already discussed. We are just summarizing it and putting it on the table so that we will have a clear idea about the differences between livor mortis and contusion.